All right. Well, why don't we go ahead and get started, everybody? My name is Joe Gogler. I am here with my colleagues, Dr. Quincy Samus and Dr. Regina Shi, along with Noor Shepherd. We're thrilled to have you join us for what we're calling the first of our Learning Collaborative sessions. We are here on behalf of the State Alzheimer's Research Support Center. And really, the goal of today was to introduce what we call the StARS Center, to talk a little bit about its origin, what it's designed to do, and more importantly, how we hope the center can help you advance your efforts around facilitating and innovating in the space of coordinated dementia care services in your states or communities, and how hopefully STARS can be a source of support in those efforts to help us all better understand why these services are so helpful, for whom they're helpful for, and how we can further disseminate them across the country. So, next slide, please. I'm going to turn it over to Nora Shepard, who is the coordinator of the STAR Center. She has some brief housekeeping notes, and then we'll get started.
Hey, welcome everyone and hello. For the webinar today, please use a Q&A box for all questions. We do have a Q&A session at the end of this webinar, and at that time, we'll address all of your questions. If you think of a question afterwards, we welcome that as well. You can direct these to our email, starcenter@umn.edu. After this webinar, you will also receive a very short survey. We kindly ask that you take a couple minutes to complete it and tell us how our first learning collaborative went. This is also an opportunity for you to share what you would like to see on future webinars. A recording of this webinar will also be posted to the website starcenter.org.
Great, thanks, Nora. And as we move on to the really brief set of slides, one thing we would ask everyone to do, thank you, Quincy, for sharing this question in chat. We'd like you to please share your name and affiliation in the chat box. That will help us see who's all attending today, and it's just a help to us and hopefully a help to you too to see who else is joining us today. So if you wouldn't mind taking a second to just enter that information in the chat, that would be wonderful. So again, our goal today here is to introduce STARS. STARS is co-directed by three individuals. Dr. Shi from Emory University, Dr. Samus from Johns Hopkins University, and myself from the University of Minnesota. But I really must emphasize this is a center that is highly collaborative and really relies on deep, broad expertise from many individuals, institutions, and organizations around the country, as you'll be hearing throughout this presentation. But again, our first step we thought would be great to kind of kick off and launch this learning collaborative is to really just share with you the basics of what STARS is and what its intent is. Next slide, please. So this is a cooperative agreement, and because it's a cooperative agreement, we work under the direction and very closely with leadership from the National Institute on Aging. The National Institute on Aging supports the STARS Center through what's called a U54 mechanism, and a U54 mechanism is really focused focused on building infrastructure to advance science. In this instance, the science, and more importantly, the actionable, data driven information to advance coordinated, integrated dementia care services and supports across the country. And we do that, again, in close partnership with Dr. Elena Fazio, who's our program officer, and Dr. Priscilla Novak, who's our project scientist. Next slide, please. So why does STARS exist? Why do we need it? There are many examples of exciting innovation that's happening at the state and community level, perhaps even at the regional level across the U.S. in the space of improving and advancing uh, dementia or ADRD, as we also call it, care coordination, integration of various acute and chronic services, and facilitating transitional care to help improve the quality of life of those living with dementia and those who care for them. However, there's also a lot of variation and heterogeneity across states and regions in terms of how they do this. There certainly is variation in state policies that support dementia care coordination and integration. There's obviously a great deal of variation in who these programs target, how they're structured, how they're delivered. The list goes on and on. How they're actually measured, what kind of data is used to support these types of programs and their potential effectiveness. And so the goal of StARS is to try to have us all work together to see how we can actually align all of this exciting work that's happening in your communities and states in a way that results in a resource that actually can be leveraged to really demonstrate and show an integrated, coordinated approach to dementia care services can really help improve key outcomes. For lack of a better term, demonstrate return on investment. And that's really the goal of StARS is to help provide this support and infrastructure to allow this resource to emerge and happen. So the objectives of StARS are as follows. One is to facilitate state-based research on dementia care coordination, integration, and transitions. Two, it's to create and integrate within state data on home and community-based services and healthcare. Um, a major focus of StARS in the end is really to help advance efforts to merge, link, synthesize data showing effectiveness of coordinated integrated dementia care services across different states in the US, across different regions in the US, to allow us to analyze and examine, well, who do these services work best for, under what circumstances, for how long, on what outcomes, et cetera, and trying to create alignment across the many, many efforts that are occurring so that we can better answer these questions. And then related to all of this is to support the dissemination of findings demonstrating and showing effectiveness of integrated and coordinated dementia care services. And we certainly believe, hopefully you do as well, is the one way to achieve that goal is to, again, align the collection, merging, linking of key data elements to do that. So in the end, this is what the STAR Center is trying to achieve in close partnership with states and other entities across the country, certainly. Next slide, please. So this is, again, I think this more or less summarizes what I just talked about, but Nora put together this really nice graphic, which really talks about the origin story of STARS. Why does the STARS Center exist? And again, there are many examples. I'm sure many of you are at the lead in doing this, at really kind of championing this, perhaps in your own states or regions. That there are many examples of coordinated integrated care programs for people living with dementia, as well as their care partners, and that has been expanding. There have been more and more examples of this happening on the ground. They could be care management programs, they could be respite programs, they could include multidisciplinary care planning. They could include and feature programs that really assist with navigating key transitions across the course of dementia. There are probably many other examples that we couldn't possibly fit on this slide. And what we want to do is to identify and work with these example integrated coordinated dementia care exemplars across states and communities to really try to determine how effective these services are. And one way we believe that we can achieve that is, again, to synthesize and harmonize and link key data that are being collected across these different efforts in a way that can make them amenable to future analysis, future dissemination. Um, so that's the beginning, the origin story, the focus of STARS. Now I'm going to turn it over to my colleague, Dr. Shi, and she'll take us through some of the specific elements of STARS and how we hope to achieve these goals. Thanks, Regina.
Thanks, Dr. Gogler. It's great to see everyone. Thanks for joining today. So we'll talk a little bit more about STARS and its components in a minute here. But first, we wanted to talk about the Learning Collaborative and why you are all here today. So the Learning Collaborative is meant to provide a platform for collaboration across the nation to disseminate findings and best practices for these coordinated and integrated dementia care programs, to share resources at state and sub-state levels, and offer the expertise of our team members to advance data integration within states and across states. And lastly, this Learning Collaborative is meant to engage with you for collaboration between you all and with the STARS Center. Next slide. So who is the Learning Collaborative for? I hope you all feel that you're in the right place. This is meant for states and local organizations. So I see a lot of folks from departments of health. There are some departments of community health here on the webinar today, Division of Aging Services, There are policymakers. We also have folks from GWEPs, Geriatric Workforce Enhancement Programs. We have Alzheimer's Association chapters and Alzheimer's Institutes on today's webinar. We have BOLD grantees, independent living centers, AAAs, state HHS agencies, as well as university partners. So this is really meant for all of those organizations, including providers and researchers within nonprofits and institutes of higher education, and also, most importantly, people with dementia and their family caregivers. So this is very broad and meant to connect you all together in this learning collaborative. Next slide, please. So I'll touch first on the partnership and engagement piece of the StARS Center. So how we hope that the Learning Collaborative will engage with StARS is by us serving as a resource to you all. Our team can facilitate discussions, planning, ideas, and steps for integrating data on dementia care services. This is not just for our formal partners, including what we call StARS states and Research Innovation Corps grantees, but to all members of the collaborative. We hope that this collaborative will provide you with the latest news and resources pertaining to data integration on dementia care programs and to create a learning community. This is an opportunity for us all to be part of conversations centered around data and people working within the dementia care industry. So we hope you will come connect with us, share, and learn across this learning collaborative. We also welcome feedback on suggested topics. This is just the first of many webinars that we hope to hold regularly. You'll receive a survey link after this webinar, and we hope that you will take the opportunity to tell us what you would like to learn about and hear about from other entities and what issues are at the forefront for you. Next slide, please. So as Joe mentioned earlier, the StARS Center is a 5-year cooperative agreement funded by NIA. We are in year 1, and our goal is to assist states and organizations to examine and advance the accessibility, the affordability, and effectiveness of dementia care services, and to share best practices and policies across states across the country. Next slide, please. At the end of these 5 years, we hope to have a national data infrastructure to enable states and communities to describe and examine the effects of integrated and dementia care services on care transitions as one example of an outcome, examine the influence of policy variations within and across states, and changes on dementia care services. And then also we hope that there will be state comparisons or multi-state collaborations of dementia care services and policies for all communities so that we can examine the effect of integrated and dementia care services in terms of their feasibility, their scalability, and their impact. With that, I'm going to turn it to Dr. Seamus to talk about the StARS cores.
Thank you so much. And so I'm going to highlight 3 particular aspects of the StARS Center that we wanted to make sure that you knew about to kind of advance these overall mission and objective statements for the StARS Center. So the first is that we will be hosting data workshops. And so this is a very, kind of, if you've ever worked with data within states and linking a number of novel data sets together, you know how hard it is. And so we have a team of experts that are going to be here to provide leadership and expertise and bring in speakers and things like that. So this is Dr. Callie Thomas, who is the Data Core co-lead, along with Eric Jekowitz, who will be leading the Data Core workshops. And really the idea is to kind of, for the StARS Center overall, will be to provide some assembly and housing of a library of data that will evaluate some ADRD focused programs. And so, for example, they're in the midst of doing a survey right now of guide participant states. So if you're familiar with the new CMS guide model, they are actively collecting data about guide participants to better understand the characteristics of organizations that are doing and participating in that model. And so that's just one example of kind of a special topic that we will be focusing on as kind of assembling information related to ADRD policies and programs across the nation. These data workshops will also provide technical assistance so that states can access and link kind of previously unobtainable data, hopefully for rapid and rapid evidence-based decision making and policy making. And we will also be providing tools and resources that will be provided to really try and harmonize data sets within and across states that are not yet harmonized. And so these are examples of data workshop elements that we'll be providing as part of the StARS Center. Next slide, please. So in terms of data, so there's another wonderful aspect and really central component to the StARS Center. So we will be able to fund what we call dementia care innovation grants. And so these are grants that are in effect to deepen the understanding of what is working. So what are those innovations that states and sub-state entities are doing to better serve the purpose of dementia care coordination, to better serve integration of medical and social care as an example, and also to better understand transitions across different care settings. And these will really be providing an evidence base on what's the best practices, what are the successful approaches that states have come up with to kind of manage these aspects of dementia care. And so some of these are just very generic examples, but for example, these dementia care innovation grants can focus on questions like this. So how best is it to transition persons with dementia into palliative care? Another example is, what is the best strategy to optimize care transitions for people across different care settings? And then another might be looking at cost benefit. So what is the cost benefit of Medicare Advantage plans for people living with dementia? So these are very broad and very generic, but I think it gives you a flavor of what we are looking for. And this core is led and supported by Dr. Catherine Ornstein and Dr. Philip Sloan. And so next slide, please. So in terms of these grants, so we're going to be able to fund up to 4 projects in 2025. And each of these projects can include funding for up to $100,000 in direct costs plus 10% indirect costs per project. These will, in addition to this, the financial resources, these awardees will also receive support from the StARS Center scientists and research staff, which will be provided through regular meetings, possibly some in-person on-site visits, direct consultations to the different cores that support the center, as well as feedback and on study progress and helping address challenging issues that likely will arise during these grants. Right now, if you search starscenter.org, and we have a QR code at the end of this presentation, you'll be able to find the letter of intent form for submitting an application for the first round of the Dementia Care Innovation Grants. This is a pretty simple form, and it will be a 2-stage competitive review process. The first stage is a letter of intent, and then if you are selected to move to the second, you will submit a full application. We will be providing technical assistance workshops. We have 2 scheduled right now, April 3rd and April 7th, as you can see. And the letter of intent due date is May 23rd. And if you are selected to move forward with a full proposal, that due date will be August 1st with a start date of the project for October 1st. And again, these are 12-month, 1-year innovation grants. Okay, next slide. In addition to the data workshops and the research innovation grants, we also are funded to support specifically what we call StARS states. Now, StARS states were selected a priori before and during the proposal process for this StARS Center. And there were 8 states that were specifically chosen to reflect geographic and regional diversity. They had readiness for data system integration for policy evaluation, had statewide integrated or coordinated care programs in place, and had existing partnerships among interstate agencies. So these StARS states will be working with the StARS Center two each year. So the first two for year one are Maryland and Virginia. These STAR states will receive $200,000 in year one to essentially develop data infrastructure that will then prepare them and lead them to do a 1-year innovation project in the second year. This is intended really to boost, data, build capacity for a sustainable data infrastructure, as well as provide the opportunity to come to learning collaboratives like this and to share, what their successes and barriers are with other states as they get underway in terms of enhancing data infrastructure. Engagement activities for these states will include providing logistical support, engagement, and expertise, like helping within states develop and coordinate partnerships among state, local, governmental, and not-for-profit organizations, as well as academic institutions within states, and facilitate access to so they also will have access to a number of national experts on panels that really are convened by the Alzheimer's Association and provide input on clinical dementia services and supports, research and research methodology, as well as policy. We will also help them develop and engage a lived experience panel to really guide how they're asking questions of the data, and that will be comprised of people living with dementia as well as family caregivers and informal care partners. So next slide, please. And as I related to webinar schedules. So with that, I will, there's a lot of questions in the chat, it looks like, so that's great, and people are responding, but I'll turn it over to Joe. I think you're going to moderate the question and answer.
Yes, and so thank you. I encourage everyone to use the Q&A tool at the center bottom of your Zoom if you could, but if you have to use chat, we will do our best and I'll be moderating. And so we have a first question here from Elizabeth Head. And I think this is a good one, and I will turn it to you, Quincy, and perhaps even our core co-leads of the Partnership and Engagement Core, Dr. Zimmermans and Dr. Fazio. This is from Elizabeth Head, is what are the dates, timeline for the 1-year engagement funds? And Regina, if you wanted to join in, please do.
Oh, no, I was going to pass it along to our Partnership and Engagement Core.
Yeah, so Cheryl, Sam, the question we have here is what are the dates, timeline for the 1-year engagement funds?
And I'm happy to respond to that. And to be clear, those 1-year engagement funds, those are only given to the STARS states, and they're preparatory funds to help build data capacity and linkages. And so that's to what the question referred. Those funds are available in this first year to Virginia and Maryland, with the expectation that the funding will start in August, and we've already had some conversations with them. So the year after would be similar for each of the 2 states that we're going to be rolling out in subsequent years, which is very different than the dementia innovation care grants. That was something that's open to everyone, and those are also 1-year grants, but they're not, we don't consider them preparatory. We consider those to be full-fledged research projects consistent with the information that's available when you go look at the information, including the
Thank you,
LOI.
Elizabeth, for that question. And good to see you too here, Elizabeth. You participate in some of our bold webinars. We appreciate it. Thank you. Question from the Kristen Fox, I saw had raised her hand. Kristen, if you wouldn't mind putting your question in the Q&A or chat, that might be a little bit easier for us to facilitate versus having people just speak it on Zoom just because of the size of the webinar. So please do that if you have a question. We have a question in the chat. Quick question, and I'll delegate this to Sam, to actually Dr. Ornstein and Dr. Sloan. Both TA webinars will both TA webinars cover the same material, just having 2 offerings to accommodate schedules. So I don't know if Phil has audio access, but
Yes.
Catherine, are you on if you want to answer?
Yes, I am. I'm happy to answer that. It's a
Yeah.
great question. We basically had two different meetings set up just so to facilitate, access for people to join at different times. And any important information we will actually keep posted on the website, especially specific questions and answers for everyone. So you only need to attend once. But if you want to attend a second time and ask your questions live of us, you're welcome to do that. You also can send your questions via email anytime, and you will get a direct answer from us. Thank
Great.
you.
Thanks, Catherine. Our good friend Dr. Epps is joining us here today. She had a question. What are the 8 states again? So, Quincy, I don't know if you wanted to run through what the 8 states were that we had.
Actually, yeah, I'll turn it to Regina because I'm not sure I have the
Oh, Regina,
list.
yeah, so,
Yeah,
yeah,
thank
go
you.
ahead, Regina. Yep.
Thank you, Fayron, for the question. So year one is Maryland and Virginia. We have already engaged 2 states per year in the subsequent years because we do not have, as with most NIH grants, funding is contingent on renewable years of funding. So we have states that have engaged with us during the proposal stage, but we're not going to release the names of the states yet until we know for sure that we have funding. As you know, there's some volatility in the federal funding space now, but feel free to engage with us. I think we know who those states are. Some of those states know who they are, but we don't want to release that unless we know for sure we have those subsequent years of funding.
Yeah, yeah. Thanks, Fayron. That was a great question. Kristen Fox, thank you so much for providing your question in the Q&A. So, again, I think, Regina, you kind of answered this, but is New Jersey one of the states, and does it have to be a state agency, or can it be a center for independent living within New Jersey? I think that latter part of the question might be pretty relevant to answer. I don't know, Quincy, Regina.
Yeah. Yeah, so in terms of is this in terms of the innovation grant? I'm
I,
assuming that that's what they're referring to. So
I'd assume.
eligible, yeah. So we're keeping it very broad because innovation is happening at all levels and all different kinds of partners within states. And so eligible applicants to be kind of the lead organization for an innovation grant will include non-federal government organizations as well as other nonprofit organizations working within states as well as higher education institutions, including public and private. So it's very broad. And so we would love to, receive, letters of intent from, addressing, coming from a broad diversity of different types of organizations, looking at different, questions.
Great. Thank you, Quincy. That's wonderful. Cheryl, did you want to weigh in?
Yes, just to clarify, although it might have been evident, so there are two different opportunities. One is STARS states, and there's those states, as Regina explained, that have already voiced interest. And as we get subsequent years of funding, we will work expressly with those states. But the Dementia Care Innovation Grants are open to any organization from any state. So it is a very separate opportunity, and also will be ongoing for subsequent years, assuming additional funding.
Thank you, Cheryl. Thank you so much. There was a really good question that Rochelle Roberts posed in the chat earlier, which has been answered. She had asked, when will guide information be made available? And Dr. Jutkowitz, one of our data core leads, responded that the data core is actively working on version 1 of the guide data set. We hope to complete version 1 by the end of spring, early summer. I thought that was a really good question. And thanks, Eric, for responding specifically to that. Another question in Q&A again from Elizabeth Head. Could you talk a bit about the difference between the two opportunities? I believe this is the difference between the partnership and engagement STAR state opportunity versus the dementia care innovation grant opportunities, and where you envision public health sitting, traditionally not direct services, when compared to state units on aging, such as direct services AAAs. So, Cheryl, did you want to answer this question? Looks like you're about to type it out, but
Oh, sorry. I think I already did, but go ahead, Joe. Sorry about that. Go ahead.
no, yeah, go ahead and answer the question, Cheryl. It'll be good for everyone to hear too. Yeah.
Okay. Well, so I think we've talked about the two separate ones. And I think where we envision public health sitting, I guess having the traditionally not direct services versus state units on aging, certainly this is both practice and policy relevant, services and policy relevant. So any organization is welcome to join. We're hoping that there will be partnerships with organizations in the applications for the Dementia Care Innovation Grants. Yeah, but I don't know, Joe, whether and you or others
Yeah.
thought there was a more specific answer to that one.
Yeah, so knowing Elizabeth being in Georgia, and as a Bold recipient, and I believe there are quite a few Bold recipients on the webinar today, where I would envision departments of health being, potential applicants to this, if not key parts of it, Elizabeth and others, is the fact that if you spent your time, say, for example, as a Bold recipient, building networks, building collaborations with area agencies on aging, direct service providers, et cetera, who have been delivering themselves some type of coordinated, integrated dementia care service and support, you actually are in a really good position to identify the key partners you may want to work with to begin the process of identifying, okay, what are the data that they're collecting to determine and show effectiveness of these programs, and how can we potentially link it to some other data source and utilize funds from StARS to do that. So in a way, it's kind of a natural extension of your bold work in that moving beyond the partnership building and maybe identification, for example, of Healthy Brain Initiative public health actions and implementing them. Now it's actually leveraging resources of StARS to put data to some of those efforts to determine their effectiveness, which again, I think could provide some really exciting synergy, if that makes sense, Elizabeth. So thanks, Cheryl. All right. Good. I'm glad you thought that was helpful, Elizabeth. I appreciate it. And it looks like that kind of Dr. White from Mississippi is here as well. Kind of, again, knowing your work and what you're doing in Mississippi, again, given that really, exciting network you've built down there, there's some opportunities here to start putting data, start getting some resources to start identifying the data underlying all of that incredible work. And that's where I think we can be helpful at StARS. So again, lots of exciting opportunities here for many of you, I believe. So, one thing I did really want to emphasize here is please do complete the survey that's sent to you at the end of the webinar. The reason why, first of all, I hope all of you are excited to be part of our Learning Collaborative and will continue joining us as we hold these events periodically. No, I forgot how often we're planning on doing this. Is it every other month? Regina, Quincy, I don't remember how often we're planning to do this. But in any event, our subsequent topics are going to be highly based on the feedback from you. If you want to learn more about, okay, you're talking a lot about data. What does that actually mean? How do we identify it? How do we work with it? Again, we believe our center is set up to provide that insight for you to help lead to a really competitive application so you can leverage some of these resources. And, these topics around, all around integrated coordinated dementia care services, what they are, how we can identify them. Again, what are potential outcomes of interest that then StARS can help support. Let us know, and then we will make sure to make future learning collaboratives oriented around that. And then also to really be highlighting all the great work a lot of you are doing already in the space and on these topics. So, okay. Do we have any other questions here? I think those are all the questions I see that at least were typed out, written. I don't know, Quincy, Regina, did you have anything else you wanted to add or?
Yeah, I mean, I would just like to highlight that, as anything, there's going to be limited funds that this center is going to be providing, but these learning collaboratives are a chance for, states, even if you're not applying or not interested in a research innovation grant, like these sessions are going to be places to kind of share and talk through challenges, because we all know that, kind of policy is really driven by if you can create, the return on investment, and show real impact on outcomes that your state, your state decision makers want to see, right? And so, coming to these sessions, what we hope to create is a really rich and candid and helpful environment to make those cases and to make those justifications that that innovations in this space are actually working and working to improve public health.
Thank you, Quincy. So as Noor had mentioned in the chat, our original plan is to host learning collaborative webinars quarterly, but we could increase frequency depending on interest. So we're going to be flexible in that regard. But again, hopefully you will find this of interest and aligned with some of the great work you're doing right now. Really good question has come up in the Q&A box by Sue Ellen Anderson. Is this state funding only?
So, yeah.
If this is for the Research Innovation Core grants, I would suggest that Catherine or Phil come off mute to answer that question.
Sure.
We have talked about that. It doesn't have to be a state agency that answers, but it really, whatever the group is that answers should address either state or regional within a state issues. And so, because this is the first time we've issued these grants, we expect to have an active dialogue and Q&A that comes up as we do our information sessions. But in general, it doesn't just have to be states, but there should be some partnership with states.
Yeah. Thanks, Phil. Appreciate that. Thank you. Getting some good feedback from people online, feeling this was informative. We really appreciate it. We're very excited to engage with all of you in your work, and we appreciate your time today. We'll couple more seconds here. If anyone else has questions or any thoughts or comments, please share them both in the Q&A box as well as chat. Otherwise, hopefully you found this useful. Again, one thing to emphasize, Nor will email you the slides as well as a link to the recording of this event, and we'll be posting it on our website, starscenter.org. And please do fill out the survey that we're going to be distributing so we can get some ideas of future topics that are going to be most useful to you. So thank you very much. Quincy, Regina, any other final thoughts or comments you'd like to share here?
No, just thank you to NIA for sponsoring this
Yes.
wonderful center. We are very grateful.
Yes, and I see multiple people, including Dr. Faggio, Dr. Novak, are online, and thanks for joining us here today. So thank you to all my
If it's
colleagues.
okay, if it's okay, just for one more minute, could we go back one slide to show the QR code?
Oh, yes, thank
Like
you.
intent,
That's a great
just so
idea,
folks
Regina.
can scan
Thank
it
you.
if they
Great
would like.
idea. Yeah, thank you. Yeah, please take a chance if you'd like to scan this QR code. This will tell you more about the whole funding process. Catherine and Phil and the entire Research Innovation Corps have done a great job in providing what I think is going to be really helpful guidance if you decide to submit your letter of intent and next steps from there. So, well, with that, I think we can adjourn. I don't know if we have any other questions or comments. I don't see any. Thank you to all my colleagues. Again, we're very excited to work with you and reach out to us at any time. If there's anything we can do, if you have any other questions or concerns that we can help address for you, let us know. But again, we're very excited to be in this with you to help advance your work. Many of you doing all of this incredible work on the ground in your states. We hope that you find the resources of STARS useful in that mission. So thanks, everyone. Take care. Have a wonderful rest of your week. Really appreciate you being here.
Good.